lot of speculation. New York City's incoming mayor, Eric Adams, announced that he is keeping de Blasio's private sector vaccine mandate, which means that basically anyone working in New York City needs to be vaccinated. And that's not all. His team brought us this New Year's Eve message.
We will also study the need for what we're calling the up-to-date mandate, which would require New Yorkers to have their booster shots under the vaccine mandates currently in place.
So Team Adams must have not gotten the message that you can still get COVID even if you're vaccinated. New York City doesn't report numbers on breakthrough cases. I am sure that's just an oversight. But we know they're happening. Let's take a look at Massachusetts, whose population is just slightly smaller than New York City. In the last week alone, 44% of all total cases were from people who have already been vaccinated. Joining me now is Dr. Harvey Risch, Yale School of Medicine professor and epidemiologist, and Dr. Marty Makary, professor at the Johns Hopkins School of Medicine and the author of The Price We Pay. Dr. Risch, we see Eric Adams is now saying he's going to keep this vaccine mandate in the city, but New York is getting crushed. We saw 74,000 cases today alone. New York City saw the biggest day of cases than any major city in the entire world. Yet we have a state that has mask mandates. We have a city of New York that has a vaccine passport. You got to be vaccinated just to go to a restaurant or, to basically live among society. At this point, why would any city, why would any business, why would any university be forcing a vaccine that doesn't stop the spread of COVID?
Well, to be frank, we ain't seen nothing yet. That this Omicron virus, we're likely to see at the beginning of next week or by Tuesday or Wednesday, 1 million cases per day in the United States. This is where it's going. This is not frightening. This is good news because it's generating a lot of population immunity. We should not be looking at the cases. And unfortunately, the health commissioner in New York City is still mired in the past looking at case numbers. He should be looking at hospitalizations and mortality from Omicron. That's what tells you what to do about policy moving forward, and he's not doing that.
Dr. Makary, now that we are starting to see, look, we're seeing so many people get COVID at this point. Do you think the government will be forced to recognize natural immunity?
Well, the public is smart enough to realize that you cannot ignore it indefinitely.
But why hasn't the government, though?
There's 141 studies. At this point, any more research is not going to convince them. They clearly have an entrenched political interest, and to them, it threatens the vaccinate everybody message. And that's the bottom line. And I think that's eventually where there's going to be so much pushback. They're going to have to, at some point, just recognize that people are not going to tolerate dishonesty in science.
But Dr. Risch, to Marty Makary's point, why do we have this push to get the vaccine when it's clearly not stopping the spread of COVID?
Well, at some point we thought that it might, but that is long in the past already. There's so much evidence around the world that it doesn't, and our own evidence that it doesn't, that we have to reevaluate. But we have entrenched interests. This whole pandemic was sold to us as wait for the vaccines will cure it. And so there's been a push from economic push to sell vaccines to every arm on the planet, if not in the country. And that's what we're facing. We're facing a push from above the government to do this and not from the science.
And Dr. Makary, it goes even beyond that now with these boosters. We're seeing some universities push boosters for students. It looks like the FDA might approve the Pfizer booster for 12 to 15-year-olds. What science is there behind that for boosters for young and healthy people?
Well, the science on boosters for young and healthy people points to the recommendation that young and healthy people should not get a booster. That's where the data lives right now. And that's why the FDA's experts, they sit on an advisory committee called VRBPAC, and it's routinely convened with any authorization decision the FDA does. That's why the advisors voted against boosters for young people. And then the FDA made a second internal push and simply circumvented those experts. They decided not to convene the meeting. And rumor is now, the New York Times is reporting it as well, that they're about to authorize boosters for 12 through 15-year-olds, again, without convening their experts. That's unconscionable. And if we have any journalism left in the United States, they should ask why. How are they getting away with this?
Dr. Risch, how do you think they're getting away with this?
This has been the modus operandi of the CDC and the FDA for the last 2 years. that the review committees on hydroxychloroquine and remdesivir were larded with pharma people, a third, 18 out of the 54 in the first committee, 11 out of 20 in the second committee, that this has all been orchestrated from the top of NIH and pharma.
You know, Dr. Makary, what kind of therapeutics are you saying? Is there anything promising that you've been looking at that we should be embracing now that we know that the vaccines aren't stopping the spread of COVID?
Yeah, there's a whole bunch of them. And, you know, immediately when Omicron emerged, our public health officials immediately started talking about additional vaccine boosters. We're now learning 10 weeks after your booster, that immunity goes down to 35%. The efficacy goes down to 35 and 45%, depending on the vaccine you got. There's fluvoxamine out there. It reduced mortality by 91%. It's been FDA approved. There's solid randomized controlled trial data supporting it. No data against it. I've never once heard Dr. Fauci or Dr. Walensky say the word fluvoxamine. Many universities, including my own, included on its recommended therapeutics list on their COVID websites. And there's, of course, the Merck and Pfizer pills, which we hear little about, but they're ready to go and they're at pharmacies now.
Well, really looks like our government is failing us miserably. Dr. Makary and Dr. Risch, thank you so much for joining me tonight. Appreciate it.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.